Professor Kobilka, thank you for accepting our interview request. It is an honor to meet you, the researcher whose name is intertwined with the discovery of G-protein coupled receptors, or GPCRs. These proteins are now in every textbook, and the researcher who won the Nobel Prize for all this, together with Robert Lefkowitz, gave an inspiring lecture to secondary school students yesterday. How easy is to talk to students about the subject that is so complex and has defined your research career for decades?
Yeah, it's sometimes challenging because students need some background in biology to be able to understand. So, but you can aim a lecture towards both students and also the adults who don't have a biological background. So it's possible, but it takes a bit more time to develop the story.
We enjoyed it yesterday, so
oh, great! I'm glad.
Succeeded. Today's young people have many opportunities to inform themselves before choosing career. And I'm not just speaking about the internet, but I'm talking about excellent lectures like the one you gave. When you were a student, how did you find your way around? What led you to become a researcher?
Well, as a student in high school, I was mainly focused on getting into medical school. I knew I wanted to be a physician. So I also knew that I needed to be good in the sciences. So I focused on chemistry and math and biology. And then as an undergraduate, again, my focus was on chemistry and biology, again with the idea that I needed to pass an exam, get into medical school. But during my undergraduate career, I also became interested in research, spending time in the lab, doing some small but interesting projects.
You graduated first in biology and chemistry, and then also in medicine. How do you use this versatile knowledge as a researcher?
Well, certainly biology and chemistry are a good foundation for the kinds of research I do. And I would say my medical training more or less led me to this area of research because as a medical student and as a resident, I was particularly interested in intensive care medicine. And a lot of the drugs we give patients in the intensive care work on G-protein coupled receptors, particularly adrenergic receptors. We give drugs that activate them, drugs that inhibit them, depending upon the condition of the patient. And that ultimately led me to the Robert Lefkowitz lab at Duke because he was a pioneer in this field.
So maybe studying medicine was very useful to be able to formulate questions, right?
Yes, I think that's true. Mm-hmm.
GPCRs are essential receptors present in all our cells. When you were studying them, what did you have in mind to discover how the body functions, or to discover something that could be used in medicine? So what was the original purpose?
I think my original purpose was simpler than that, just to try to understand how they worked, and the structural basis of their signaling. And ultimately, I then, as we advanced and made progress there, I've become interested in using structural methods to help develop drugs, safer, more effective drugs.
And how has the discovery of GPCRs changed medicine? What are the areas that have been most affected by the discovery of these proteins?
I think that's sort of difficult to answer because I think people were targeting these proteins even before we knew exactly what they were. They were targeting dopamine receptors, serotonin receptors, because they knew what the agonist was, and so where they were finding drugs that looked similar to native hormones and neurotransmitters, and modifying them so that they either inhibited or activated. I think having a knowledge that there are this huge family, we discovered some receptors that we didn't know exist. We call them orphan receptors. We still don't know the hormone or neurotransmitter in the body, but we know these receptors are, for example, located in the brain, and they may be important in behavior, and we can start targeting them for drugs, even if we don't know what their native hormone or neurotransmitter is.
The path to the discovery and the description of GPCRs is a series of logical steps, at least looking back from today. Yet the progress took many years. What has been the most difficult part of this research?
Well, the research itself, I would say, the difficulty was the nature of these receptors. When you're trying to obtain a structure of a protein, at least early on in my career, it required being able to crystallize the protein. And in order to crystallize a protein has to be quite stable and exists in one conformation. The problem that we've discovered with G-protein coupled receptors is they're not very rigid, they're very flexible, they exist in many conformations, and I think that was the biggest challenge in obtaining at least crystal structures. More recently, there have been advances in cryo-electron microscopy, and it's possible to obtain structures without any crystals, and that's really led to major advances in the field over the past, say, 5 or 6 years.
The Nobel Prize is without doubt the greatest milestone in a researcher's career. How did this prize influence your later research career? Is it possible to go back to the lab and continue where you left off after such a prize?
Yes. Certainly, I mean, the biggest impact that it had on my career was probably being somewhat of a distraction in that you get invited to go many places, and it's great for my wife and I to travel to places like Hungary, and we've met many people all over the world, and that's great. But it is a bit distracting from the research. I was fortunate to have really talented students and postdocs who have continued our progress in this area.
Balancing family life and being a researcher is not always easy, especially when both members of a couple are researchers. How was managed this in your family?
Well, my children were born when I started my residency training, so which meant I was away much of the time, and my wife really managed the family and took care of everything. When I moved to Stanford, my wife started medical school, and so I became sort of the primary caretaker. So we traded off, and it's really important to have a partner who is willing and able to take up the slack when one of us was needed for other things. The other partner could always be there for the children and the home.
Cooperation is important, not only in science, but also in family.
Exactly, yeah.
What are the external factors and what are the internal qualities that can explain your success? What advice would you give to a novice researcher on how to improve if he or she wants to become successful?
My success had a lot to do with finding colleagues and collaborators and students and postdocs who are interested in what I did and willing to collaborate on these very challenging projects. I would say it didn't have as much to do with my personal talent as a researcher, but perhaps my good fortune in finding the right group of people to work with.
As a Nobel laureate, you travel around the world and you see many examples how different countries handle science. What is your opinion about the program which invited you to Hungary? So what do you think? Is it useful to invest in science in the education of young researchers candidates?
I think it's very useful, and it's very important to start early to engage people in science. But it's also very important to support young researchers both during their training and as they become independent investigators, to provide adequate support to allow them to succeed early on in their careers.
Thank you for this conversation. It was an honor to speak with you, and I hope that we can meet soon in Hungary. Thank you.
Thank you.